Thank you for choosing to watch the Healthcare Organizational Behavior news article with Misty, Eyez. Thank you for inviting me to come and speak with you today. As you know, each and every one of us wear many, many hats, many, many roles, and there's a lot of intersectionality to each and every one of us. Many of you might know me as an activist. I'm a diversity, equity, inclusion speaker and a motivational speaker. I am also an entertainer here in South Florida, and you definitely know me as an FAU executive MBA student and an MHA student. Organizational behavior. According to our book, organizational behavior is the study of individual and group dynamics within an organizational setting. This would be the intersection between human behavior and the organization. The obvious change between who we are in work and outside of work. Many of us might call this code switching. Many communities of people do code switching. When they are with their friends, they talk a certain way, but when they are in a different environment, they talk a completely different way. Some people have no idea they're doing this. And then others are obviously behaving completely differently at work than they do outside of the organizational role. The Healthcare Organizational Behavioral news article I found was from Tuesday, October 25th. In the Becker's Hospital Review, titled Nursing Groups Update Guidance on Mitigating Workplace Violence. This article obviously had my attention. The why. I'm glad this is here, but I'm sad this has to exist. So as I started to go into my wormhole and go into a deep dive to look and learn and understand, I then discovered that these policies were updated after a shooting at the Methodist Dallas Medical Center on Saturday, October 22nd. The original AONL, or American Organization for Nursing Leadership, and the ENA, or Emergency Nurses Association, plan for mitigating violence focuses on any act or threat occurring in the workplace that can include verbal, nonverbal, written, or physical aggression, threatening, intimidating, harassing, or humiliating words or actions, bullying, sabotage, sexual harassment, physical assaults, and or other behaviors. And impressively, this involves or concerns all staff, licensed practitioners, patients, and or visitors. This basically covers anyone in the building with any act of violence. And yes, it does include bullying or aggression, which also includes robbery or active shooters. When looking into hospital violence, I found a 2020 survey from the American Nurses Association that found that workplace violence and bullying were the top two of the 12 significant risks that nurses reported and experienced at work. 23% reported verbal and nonverbal aggression from authority figures. 31% reported verbal and physical threats from their patients, and 35 reported violence from family members of their patients. Fortunately, according to the American Hospital Association, 60% of the hospitals surveyed this year had already implemented the Workplace Violence Prevention Initiative. One of the guiding principles that I really liked, or I liked the most, was the policy that addressed workplace violence from establishing a zero tolerance standpoint. It also focused on establishing support from HR, nursing staff, legal services, security, risk management, and other staffing support, all of which are creating a culture of safety within the hospital. However, to officially pull off any policy changes, it needs full commitment and action from each and every member of the organization, from leadership to staff to patients and visitors. Therefore, we need to sign on the dotted line because we're going to be part of this. There are four main priority focus areas of the original policy. Number one, foundational behaviors to make this framework work. This would include respectful communication, including active listening, honesty, trust, and mutual respect demonstrated by all. Number two, essential elements of a zero tolerance framework. This would encompass all forms of violence, needs full support from the organization's board and C-suite to ensure a complete and total cultural shift. Number three, essential elements to ensure ownership and accountability. This would include every person must be fully and personally accountable and responsible for reporting and responding to incidents of violence. In order for a zero tolerance policy to work, it needs the input from every staff member on every level of the organization, thus entrusting staff to co-own the process and expectations. There needs to be a solid structure to report incidents of violence immediately with accessible procedures, ensuring the option of anonymity. And then the fourth one would be essential elements of training and education on violence in the healthcare workplace. Staff needs to learn violence risk reduction skills and preventative policy practices, including training on early recognition and de-escalation, which will lead to better outcomes in the metrics of the program's success, decreasing incidents of the workplace violence and harm, and improvements in risk assessment analysis. The news article that I found about the update was primarily focused on including a toolkit to support hospitals in creating and personalizing their very own violence prevention program for their staff, while mitigating workplace violence by establishing support through the entire organization, and to help ensure the continued reporting of incidents. And my two references. The original article I found in the Becker's Hospital Review was the Nurses Group Update Guidance on Mitigating Workplace Violence. And then on my deep dive, I went and read the original policy, which I found in the Journal of Emergency Nursing, the AONA and the ENA's, American Organization of Nursing Executives, or Emergency Nurses Association, Mitigating Violence in the Workplace. Again, thank you so much for watching this little tiny presentation. And if you do have any questions, please put them in the discussion and I will get to them. I appreciate you for watching. And thank you again. My name is Misty Alicea, or Misty Eyez, or Misty Eyez Alicea. And I even put a little LinkedIn barcode thing on the bottom of my screen if you want to be LinkedIn friends. Looking forward to working with you in class.